Ilsedora Laker, thank you for joining me in the trenches.
Thank you for inviting me.
I've spent quite a long time trying to find somebody who knows a lot about German new medicine, and it's quite difficult. And it seems to me that it's not a terribly well-known concept. Any idea why that might be?
Well, a lot of the information has been suppressed. Dr. Hammer had a very difficult time right from the beginning. He was censored to a great extent. He would want to speak at a venue, and they would close the venue down. Police on the at the entrance. So it was very difficult for him in the beginning. He was much maligned in the process, so there was an attempt to destroy his reputation and his character.
But knowing that immediately makes one want to know more about it.
Yeah. Well, I did. As soon as I heard about it, it was like a revelation. It was quite extraordinary after being in natural medicine for 14 years, and we were involved in diet and cleansing and detoxes, etc., herbs and vitamins. But then all of a sudden Hammer appeared, and he answered all of the questions we had in the process of working with patients. So it was quite extraordinary.
What is your background?
Well, it depends which background you're looking at. I started off as an opera singer, and I performed until around 1998. So, but the family business was in natural medicine since 1981, and I was quite heavily involved. And my husband is a clinical herbalist, so we studied together. And in the beginning, I saw patients and worked with them with, the usual detoxes and herbs, etc., diet. And then I kept pursuing my career until 92, when I was introduced to Dr. Hammer's work. And it was a set of tapes. It was a 3-hour lecture that Dr. Hammer gave in Innsbruck in 89. And I had it on a pile of tapes in my car for the longest time before I actually listened to it. And that was a moment that changed everything.
What do you mean by changed everything?
Well, the way we saw medicine. It was in German, so as Dr. Hammer was speaking, I was interpreting for my husband. And we just looked at each other and said, wow, it's the missing link. Dr. Hammer explained the cause of disease and how a disease naturally progresses if it's allowed to go through what he calls the healing phase. So it certainly answered a lot of questions for us with some of the diseases that we were dealing with. My father was a great example of that. We thought that a heart attack, which took my father's life, a heart attack was because your arteries were clogged. It had nothing to do with that. It had to do with what we call an epileptic or epileptoid crisis, which is a healing crisis of sorts. It's a turning point. But some diseases, of course, when we're looking at the heart, when the heart goes through that massive kind of a stress, it can take your life. So these epileptic or epileptoid crises are a moment in time where your survival is determined in some cases. So when we understood the nature of the conflict, and my father had a coronary infarct, which meant that there were some arteries involved. And Dr. Hammer explained that a territorial loss conflict had something to do with that. So we looked at my father's life. He died about 6 years earlier, very suddenly. And he was doing everything right according to us. He was on a raw food diet, a cleansing diet. He took herbs, meditated, and yet he died of a massive heart attack. But that was the healing crisis that took his life, and we didn't understand that until Hammer explained it to us.
Okay, so let's go back to basics. What is German new medicine?
Well, it's the discovery that your experience in life, if it is unanticipated, will simultaneously affect the brain, the psyche, and the organ in a split second. And this is a process that we call the DHS. This is after Dr. Hammer's son, who died tragically at the hands of the Italian Crown Prince, Victor Emmanuel. Dirk Hammer syndrome, DHS. And it was because of that Dr. Hammer developed a testicular cancer, which he almost didn't survive because of the repercussions of the surgery. But yes, so an unanticipated event registers in the brain and simultaneously affects the organ. And it's the psyche that actually first perceives this event. So depending on how you perceive it, that will determine precisely what part of the brain and what organ will be affected.
Okay, so take me through the basics. I understand that there are 5 biological laws.
Mm-hmm. Well, the first biological law involves this moment in time when we have the shock, the DHS. It's actually called the iron rule of cancer. The second biological law explains the actual disease process from the moment in time that you have the biological shock right through to the end of what we call the healing phase. The third biological law is the ontogenetic system of tumors, where Dr. Hammer actually discovered that different areas of the brain control different cellular structures or germ layers in our body. And this is what will determine whether or not we will have a cancer process or what he calls a cancer equivalent disease, which is really just a functional disturbance, such as diabetes, for example. And then the fourth biological law explains how all of these microbes play a role in our bodies, in particular in the healing phase. And the fifth biological law is the quintessence, in other words, the biological meaning behind every disease manifestation.
Yeah, so the terminology matters. So, for example, when you say disease manifestation, what does that mean, for example?
Well, for example, a skin condition, we call that a disease, right? Eczema, which is actually a healing phase. So during the conflict active phase of some cellular structures, we don't have any symptoms whatsoever. But as soon as we go into the healing phase, in other words, resolve the conflict, this is when we'll have the physical problem.
Yeah, and for example, you say conflict. So okay, so let's unpack that a little bit. What do you mean by conflict?
Well, biological conflicts are different from psychological conflicts in the sense that we need to have that unanticipated event in order for the brain and the body to become involved, right? So, for example, let's take a starvation conflict, which would give us a liver tumor or multiple liver tumors. As soon as we have a situation in our lives that we didn't expect, for example, you lose your job and you were the sole breadwinner, you had a couple of mortgages on your house and payments on the car, utilities, etc., you're living month to month. If you lose that income, what would happen? It's financial ruin, isn't it? So we are looking at a possibility of starvation either for yourself or for your family, in which case the liver would become involved. Another example would be if a patient is on traditional chemotherapy and they're unable to eat, and they are literally starving. They're emaciating, they're starving. The liver can become involved in that sense as well. So it's a very real conflict, very important, that threatens your survival. And this is when we will develop a liver cancer. It's the precise nature of the conflict that is going to determine what part of the brain is affected and simultaneously what organ that is connected with that specific brain relay. Now, what's interesting is that as soon as the conflict is resolved, in the case of a liver cancer, whatever tumors had developed or growths had developed during that conflict active phase, they actually stop growing.
Breast cancer, which is quite common. Now, there's something there to do with nourishment, feeding.
Absolutely. I think what you were describing really is a lobular kind of breast cancer, which has to do with nurturing. Then we have the intraductal breast cancer, which involves the milk ducts. And in that case, this is a completely different conflict. It has to do with separation. So if we compare the tissues that are affected when you have a lobular cancer, this involves the breast gland. And anything glandular, you will have a cell mitosis during the conflict active phase. In other words, enlargement of the gland. But as soon as the conflict is resolved, the growth stops. And depending on whether or not you have the microbes in your system to degrade what had grown, that will determine whether or not it's going to become smaller and in a lot of cases disappear, or if it will become what is commonly known as an adenoma, which is benign. Then in contrast to that, we have the breast, the milk duct, which actually during the conflict active phase, we have no symptoms with the exception of the stress. We have ulcerations occurring inside the milk duct. And as soon as you resolve the conflict, this is when the restoration of those ulcerations will take place. And this is what you call an intraductal breast cancer, when in fact it's really just a swelling of the tubes that transport milk. It's not actually a tumor that's developing in the milk ducts.
I was chatting to somebody close to me, leading up to this conversation with you, and she was saying to me that her mom died of leukemia, and she said that she actually believes that her mom brought it on to herself, because what happened was she had retired from a job that she really enjoyed and ended up not knowing what to do with her life. And of course, it brought on depression and anxiety and all sorts of other things. Do you think that there is some sort of connection there?
Well, it's possible, but we have to also understand that leukemia is a healing phase. It's a recovery phase of the bone marrow, which was destroyed during the conflict activity. So unless she had some symptoms before, perhaps a low white blood cells or anemia or low red cells, she would have had to have a DHS to determine the leukemia and when it would develop. It's a healing phase, so she must have come to terms with something. Now, what's interesting about these healing phases that present us with serious illnesses like a breast cancer, or in some cases a bile duct cancer, or a bronchial carcinoma, or a bladder cancer, or you name it, a leukemia. But what happens is that you can be in conflict for years and not have any symptoms. But as soon as you come to terms with it, this is when the disease manifestation will take place. So it doesn't seem fair, does it?
No.
But I think this is where we get very confused in GNM, because we have been programmed to believe, or conditioned to believe by traditional medicine, that everything has to be fatal if it's diagnosed as a cancer, when in fact it's completely wrong. I think if people really understood the 5 biological laws and what Dr. Hammer discovered before they were diagnosed with anything, they would look at it with different eyes altogether. They would perceive that diagnosis differently.
So we've been chatting about the triggers and the severity of the conflict and how it connects to the brain or that area of the brain. But now, in terms of the second law, there are two aspects to it. Am I correct?
Yes, the law of two phases. So we have a conflict active phase, and this is where the terminology comes in again. Dr. Hammer called that sympathicotonia. That means that the sympathetic nervous system is affected at that very moment. You're in high alert, you're in a stress phase. And then, excuse me, when you resolve that conflict, you go into the healing phase, or the vagatonia. And that vagatonia is divided into two. We have the epileptic or epileptoid crisis right in the middle of that, which is the turning point where we are supposed to go back to normatonia. But again, it really depends on the length of time that you were in conflict and the degree of the healing phase that you were in. If the heart is involved, it could be it could mean a fatal heart attack if you had a conflict that was of long duration. It depends really on the amount of stress that the organ experiences during the conflict active phase. Now, cancers, what we call glandular cancers, or let's say a lung cancer, a liver cancer, a bowel cancer, they're all directed by the oldest part of the brain. And they will all develop tumors during the conflict active phase. But as soon as the conflict is resolved, those tumors will actually stop growing. And like I said before, if you have the microbes, the TB mycobacteria in particular, in your body, then they will multiply during conflict activity, and the body will set them loose as soon as you go into the healing phase. And this is when the degradation of those tumors will begin. For example, a bowel tumor is usually discovered when you have bleeding from the bowels, right? But that's already the healing phase. That means that the tumor is being broken down. It has actually stopped growing at that point. But then that's when we're diagnosed. So what happens? The person has a shock about the diagnosis, right? And this is how a cancer will spread.
What is required here actually is quite a large paradigm shift.
Yes, very much. For me, it wasn't much of a paradigm shift because we were looking for answers. We saw that our methodology of healing was successful in some cases, but not in all cases. And it wasn't until we realized that the successes were in what we call healing phases. So what we really did was support the body in the healing phase to help them to get over a process.
But now let's just think back now to the last few years. Now, I don't believe that there was a pandemic, and I'm sure you don't either. But
No.
there were people who ended up getting sick, and I suspect that is related to their mental condition because of perhaps all the propaganda and the fear campaigns, etc.
Yes, absolutely right. A lot of people breathed a sigh of relief when they came up with a vaccine, believe it or not, whereas others were terrified of it, right? And people that were terrified of it, that were forced to take it, or they would lose their job, they're the ones that got sick.
I'd like to go on to the third law now. What did you call it? I have my notes here.
The ontogenetic system
Correct.
of tumors.
Okay, so take me through that.
Okay, well, we have essentially three embryonic germ layers that comprise our organs. Okay, we're going into embryology a little bit here. Now, these three germ layers are controlled by four specific areas of the brain. So we have the oldest part of the brain, which is the pons of the brain stem, which controls the oldest germ layer, which is the endodermal germ layer. Then the second oldest is the cerebellum, which controls the mesodermal or the old mesodermal germ layer. Now, the difference being that all glandular manifestations or organs that were derived from the old intestinal mucosa or organs which dictate our vital function, they're all controlled pretty much by the pons of the brainstem. And in this case, the endodermal cells, and in the case of the cerebellum, the old mesodermal cells, what we actually have is a cellular growth during the conflict active phase. So as soon as you have this biological shock, this is when you will have some cell mitosis. Okay, and this is what we call a liver tumor or a lung tumor or a bowel tumor. Okay, the cerebellum controls the skins around our body, the dermis, also the skins inside our body, which is the pleura or the peritoneum, or the envelope around the heart, which is the pericardium. And it behaves very much like the pons, where we will have cell mitosis during the conflict active phase. But in both cases, as soon as the conflict resolves, these cells actually stop growing. And one or two things can happen. Either the tumor or the growth will remain dormant, or it will degrade with the help of the TB or TB-related mycobacteria. So when we go into the later development of the brain, and this really has more to do with how our bodies evolved, and these parts of the brain had to develop to accommodate that. So when we developed a skeletal system, this is when the cerebral medulla came into play, and in this case, everything behaves the opposite to the old brain, which is the pons and the cerebellum. In this case, all of those organs that are connected with the cerebral medulla, or the white matter as it's called, those tissues will necrotize the moment that you have a biological shock. So let's take the bones, for example. If the conflict is very, very deep, then it will go to the bone marrow. And here we're looking at self-devaluation conflicts. So when we're looking at that kind of a manifestation, there is an actual suppression of the bone marrow function. And you have low white cells in many cases. You also have low red cells. And but we can go about our daily lives like that without a problem. However, as soon as you resolve the conflict to do with the bone marrow, this is when you'll develop what we call a blood disorder known as leukemia. Okay, now leukemia will also run its course according to the law of two phases. It's a matter of understanding it correctly and aiding the patient in perhaps if the red cells are late in starting up, they may need a blood transfusion towards the end of the healing phase, so on and so forth. But it begins with a necrosis, in other words, no symptoms, with the exception of the stress phase. Now, we also have the cerebrum, which behaves very, very similarly to the cerebral medulla. And in this case, what we have is an ulceration that would develop on the organ. So here, the cellular structure we're looking at is new mesodermal for the cerebral medulla and ectodermal for the cerebrum. But they behave very, very similarly. However, again, the devil sits in the details when we have the healing phase kick in, and this is when you might have a diagnosis of an eczema or intraductal breast cancer or a bile duct cancer, etc., etc. So,
but how is it that certain therapies successfully treat those symptoms?
Well, therapies will only be successful if you are in the healing phase. This is why sometimes a patient might reverse a cancer if they have chemotherapy.
Right.
And other patients, it may not reverse. Instead, it might grow further.
In actual fact, most cases do that.
Well, we need to understand what the patient is going through, and is this a metastasis that is as a result of the prognosis, et cetera, where there is no hope, or they've been given a certain amount of time to live, get your affairs in order, et cetera. It's very demoralizing for a patient, and I don't know anyone that can overcome it unless they're made of steel.
Or something simple like an aspirin, which treats the symptoms of a headache.
Right. Well, we have to understand the way these substances work. They actually fall into the two categories of sympathicotonia or vagotonia, which is the active phase or the healing phase. So any pain reliever, which is anti-inflammatory, would be sympathicotonic. And what it does is it suppresses the healing phase symptoms. We look at coffee as a remedy for a headache occasionally, right? Why does it work? Well, it works because it's sympathicotonic. In other words, it's a stimulant. And if you take a stimulant when you are in a deep healing phase, it's going to offset those symptoms.
But is that a good or bad thing?
Well, if you take a simple remedy, it's a good thing, right? But if you take the drug, it could be a bad thing. There could be repercussions, and serious repercussions in some cases. But, we are conditioned to take stuff for what ails us, right? I don't think people are going to change anytime soon in that regard. But then someone like me, if I get a headache, I question straight away, okay, what just happened? Am I in a healing phase, or am I maybe in an active phase? Because you can have a headache from an active phase as well. So, and then I start to work out the problem. So I don't take stuff.
But you make a good point. When my wife was pregnant, she wasn't allowed to take anything just about, which goes to show.
Exactly.
Does German new medicine apply only to humans, or does it also dovetail with animals?
Oh, no, very much so. Absolutely. We have to decipher the language that animals are speaking in order to be able to help them. Every animal, every species has its own code of behavior. They all have DHSs. As a matter of fact, a DHS is really meant for us to adapt in some way. If we cannot solve the problem, our bodies will express a good way to adapt to the problem. For example, the liver cancer again. This is to help the liver or the body to resorb nutrients more efficiently by developing another part of the liver. In other words, the organ is expanding, it's growing to accommodate the problem. Right? A stomach cancer, it secretes digestive enzymes in order to digest that morsel that you have difficulty coming to terms with. We're talking about an indigestible anger for a stomach cancer. Always over the morsel, and the morsel is something that we need to survive.
What you're saying is that if a dog has parvo or gets cancer late in life, it's also to do with a conflict of sorts.
Absolutely. They react exactly the way humans react to a DHS. The circumstances may not be exact, but they do react. I think Dr. Hammer also observed animal behavior for quite some time to be able to come to some of his conclusions, and some of those traits cross over to humans. For example, a boundary demarcation conflict, which would give us a bladder infection. Animals are very territorial in that sense. You take your dog out for a walk, he's going to find a shrub or a tree, and he's going to mark his territory. He's making sure.
What German New Medicine is proposing is that all of these things that are in our gut, for example, the gut flora, etc., these are helpful microbes. They're not there to harm us.
Mm-hmm. Absolutely right. They live in a symbiotic relationship with our bodies. And it's only when we go into any kind of a healing phase, in other words, we've resolved the conflict, that they're literally set into motion.
So when Louis Pasteur proposed that we take germs out of milk, it was a very bad idea.
Oh, absolutely. But I think, didn't he recant his own theory? His work is in Princeton University, and he did recant everything that he had discovered.
So he was a fraud?
Yes, absolutely. He was a fraud. So really the germ theory is based on fraudulent facts.
But let's just stay on that for a second, because that's pretty important. I mean, just about all milk that you buy today is pasteurized,
Right.
and everything that's happened over the last few years has been about microbes attacking us.
Right.
It's all nonsense.
Well, it's big business. I think you've interviewed others that agree with you, right? That it is all nonsense, that it has been misinterpreted and it's being taught as such. So, scientists these days have little choice but to go with their teaching. They don't ask questions anymore, which is unfortunate. And people like Dr. Hammer, who did ask questions, are literally crucified for it. The environment is a reminder of when they had a DHS. You see, when we have a biological shock, there are billions of bits of information that are being processed by our psyche. Of course, the most important bits are the ones that will remain and will affect us in the future. These are what we call tracks. So really what happens is that the moment we have this biological shock, a compartment is created in our psyche or our subconscious mind. And that compartment stores all the information. Now, when we have a second event that is the same or similar, more information will go into that very same compartment. These are what we call tracks. And whenever we are exposed to these tracks or reminders, this is when there is a great potential for us to develop some kind of a physical problem, some kind of an ailment. This is really the basis of chronic illnesses.
But Ilsedora, what happens in situations where it appears to be collective, like, for example, chickenpox with kids that going to school, or seasonal flu, where loads of people predictably
they did, in fact, have a collective conflict. Chickenpox and measles is all about separation, right? So it is a healing phase, and what gives it away as a separation is the fact that they would develop a fever. And you only develop a fever if there is a conflict that was resolved in the sensory cortex of the brain, and the sensory cortex of the brain responds almost exclusively to separation conflicts. So it's in fact the epithelium, the outer skin, that's affected. And during the conflict active phase, you have these microscopic ulcerations during the stress phase. So let's take, for example, kids that all of a sudden the teacher leaves, and for unknown reasons, and a replacement teacher comes for a couple of months or so. Their original teacher returns, and next thing you know, there's a measles or a chickenpox epidemic. That's because they experienced a separation, and now the teacher's back and they've resolved the conflict. Okay? But meanwhile, we see this, or we are convinced that this is something of an epidemic, when in fact they all had the same kind of conflict.
Which is why it happens when they go to school.
Exactly. And I see a lot of people getting sick around Christmas. What do we do at Christmas? Well, we see our families and we take a break. You know, we relax, we put everything behind us, and next thing you know, you're down with the flu. Now, any kind of respiratory ailment, lower respiratory, that will develop a cough, that will materialize literally within 36 to 48 hours after you find a solution to the conflict. So this is a good way to pay attention as to what you resolve, because it's in such close proximity to when you get sick. So that's the question that you need to ask yourselves. What just happened? What did I resolve? And there's always a common thread, and that has to do with fear. It's a situation that they feared.
So, for example, you know that winter's coming, and so you know that you're going to be indoors, it's going to get colder, it's going to be perhaps wet and rainy, snowy, whatever, and so you start preparing mentally for that, but it's not exactly a positive experience.
Well, that is not a DHS. You see, we have to include that element. Without that, we don't get sick. We're preparing. A DHS means that we're not prepared. In other words, you need to be in a stress phase before you will get sick.
Which also explains why not everybody gets sick.
Exactly.
Because we always talk about who gets sick, but we don't talk about who doesn't get sick.
Yes, well, in a family of sick, maybe one or two get sick. Maybe they shared an experience. Nobody else got sick. How do we explain that if it's contagious?
Yes. Well, obviously contagion then is nonsense.
Yes, absolutely. Absolutely. I mean, if we have an open wound, and we get dirt or something into it, it can become infected. Or surgical wound, you know, we can introduce microbes into open wounds and it can become infected. But over time, the body deals with it, right? The same way you have a cold and a flu, the body deals with it. It's only when we look at history and pandemics and why people died, we have to appreciate that 400 or 500 years ago, let's say when we had the plague, these people were malnourished. Their bodies had absolutely no resistance. You know, so if they got sick and they got a fever, there was always a high chance that they might die. But that's not the case anymore, right? We're not malnourished.
Do you think we have a very impoverished understanding of health and well-being?
Oh, it's absolutely wrong. Absolutely wrong. Everything that we believe or believed up until Hammer was wrong. He stood all of medicine on its head. It's quite extraordinary. And what he discovered in that 35 years since he understood the first biological law, it's vast, absolutely vast. It changes everything. And this is why there was so much resistance, because current medicine is built on misconceptions. How can they possibly have any success when something is built on something that is incorrect?
If you ignore medical intervention, how then do you treat something. Let's just use an everyday example like a headache
Right.
or a skin rash or something.
In some cases, intervention is necessary. In serious cases, absolutely. And Dr. Hammer agreed with that. He was, after all, a medical doctor. He wasn't some woo-woo. He was a serious medical doctor. He was the youngest medical doctor to ever graduate medical school in Germany. He was an internist. He worked in psychiatry. So he understood the psyche and the body like no one else. It was quite extraordinary. And if he didn't know something, he would research and research and research until he figured it out. So the training is all wrong, for one. Okay, in order for this to change, they have to begin training doctors differently and according to what Hammer discovered. Now, the only way I see that happening is if there are some brave doctors, and there are some doctors that are in my courses now, some brave doctors that are challenging the system and are doing their own thing. They're working with patients differently because they don't see any results with what they're doing.
But why is German new medicine such a threat if it's helping people?
Oh, well, consider that if everybody that understood GNM at the time that the pandemic hit, do you think they would have successfully vaccinated that many people globally?
Yeah.
Right?
Yeah.
So we have to be kept stupid. And the only way to do that is to malign the discoverer of what goes against what they're doing. I think there might have been a suspicion. I mean, we already knew that stress was instrumental in making people sick. We know that. But I think he wanted to know why specifically, in particular, because his cancer was so precise. It was a testicular cancer, and he lost his son. You cannot procreate without the testes, right? So the fact that it affected that part of the body, I think, spurred him on to try to understand why he became ill after his son died. And the kind of testicular cancer that he develops during the conflict active phase. It doesn't grow when the conflict is resolved. So it was literally within 3 months that he had the surgery to remove the testicular tumor after Dirk died. And when I first met Dr. Hammer, this is going back to 1999, I asked him, because I knew his background was traditional, I asked him, you didn't understand GNM when you got sick, why didn't you take chemotherapy? And he said to me, Ilsedora, I don't know of any doctor that would subject himself or his family to chemotherapy. And that's why he only had surgery. But even surgery was dangerous for him because he developed a very serious peritoneal infection, and he had only, I think, 5% of surviving that. So
what you're describing is effectively the fifth law, which is that every conflict has a biological meaning. There's a purpose.
Exactly. So that means that, for example, some cancers will develop during the conflict active phase to accommodate or to adapt, right, to help the individual to adapt, to accommodate the conflict. And then others will only fulfill their biological meaning when the conflict has been resolved. For example, a bone cancer. Or a testicular teratoma. A testicular cancer. There are two kinds. The one Dr. Hammer had was a teratoma. Now we have another kind of testicular cancer, which involves different cells, different tissues, that will only occur when the conflict has been resolved. So this actually augments the testicular tissue, whereas the teratoma, you have 3 different germ layers that are growing simultaneously. And these are the same germ layers that develop the moment that the egg is fertilized and becomes an embryo. So we're looking at procreation in both cases. So a territorial, a loss conflict, a very profound loss conflict, a sudden loss conflict is going to affect the testes in men and the ovaries in women.
So there is an incredible amount of brain-body connection. And as far as, correct me if I'm wrong, but this can even be seen in things like CT scans.
Oh, yes, absolutely. That's something that Dr. Hammer discovered, the connection he discovered early on. He was still working in traditional medicine, and he was on duty in emergency when a heart attack patient came in. And in this case, it was a coronary, and he came in completely without consciousness. So when someone comes in unconscious, the protocol is to do a CT of the brain. And here we're looking at the 1980s. Dr. Hammer couldn't have discovered this connection until then, because the CT wasn't actually invented until the 1970s sometimes. So it was a very, very new kind of imaging that they were using. So they took a CT of this gentleman, and when Dr. Hammer looked at it, he realized that there was a pocket of fluid or edema precisely in the part of the brain that neurology already understood had to do with the heart rhythm center. And that's when he made that connection, that the brain actually mediates what goes on between the psyche and the organ. It was a healing phase, right? Because we're looking at edema. Edema will only occur in the healing phase of a biological program.
What is the significance of being right-handed and being left-handed?
Oh, it is very significant. But, we're looking at how the brain is wired, okay? It is significant when we're looking at, let's say, cancers or skin manifestations, for example, that are on one side of the body or the other. With cancers, we're looking at breast cancers, testicular cancers, ovarian cancers, etc., etc. Dr. Hammer found that in right-handed people, the right side of the body will respond to issues to do with partners, and the left side of the body has to do with issues with mother and children. Now, in left-handed people, that is completely opposite. So if we're looking for the cause of a breast cancer, let's say a separation conflict in a female that has given them an introductal cancer, we need to establish their laterality, right-handed or left-handed, to be able to determine whether or not the breast cancer was as a result of a separation from her mother, her child, or her partner. It's very precise. It's quite extraordinary how he managed to put these pieces together. And I can guarantee you I've been working with this since 1994 officially. And it's absolutely correct. It's mind-boggling how he managed to put this together.
Does it actually make a difference? Because it's always in hindsight. Oh, okay, so I see that you're left-handed. Oh, okay, I see that you're right-handed. At which point, isn't it already too late?
Not at all. I found through my own experience over the last 25 years that when we understand the conflict and its origin, in particular the programming biological shock, that we can alleviate symptoms immediately. It's quite extraordinary. Skin conditions, arthritis, rheumatoid arthritis, the most common ailments, migraines, you name it. They can be reversed immediately. Now, introductal breast cancer is a little bit more difficult, but nonetheless, unless we establish what is preventing it from completely running its course, it will continue, and it can create problems down the line. Of course, it depends on the individual.
What role does diet and toxins and environment play?
Well, I eat almost organic foods. I don't like preservatives. My environment is clean. I think it's important because they can compromise certain conditions. If you're dealing with a toxin and a chronic illness, it's probably a lot better that you try to eat naturally and stay away from preservatives and environmental poisons. We know they do make you ill cumulatively. So, and it's the same for radiation, right? Because radiation destroys cells. Radiation, if people are exposed to radiation, it can induce leukemia when the radiation leaves your body. So these environmental toxins can create illness.
So like smoking is still not a good idea?
Well, if you want black lungs, then go for it, but it's not going to give you cancer. For that, we need a biological shock. In other words, for there to be a cellular change, we do need a biological shock.
Well, that's a good point, because I know lots of people who live till age 94. They smoked their whole life and
Exactly.
They didn't get cancer.
Right. They weren't worried about it.
No, they died of a heart attack.
Which is a healing crisis.
What, a heart attack?
Yes.
I'm struggling to get my head around that. Can you explain what you mean? Because a heart attack, it ends somebody's life. How is that?
Well, it depends on how much damage was done to the heart muscle in the process, and how much damage and how long the patient was in conflict. It goes without saying that any disease where you were in conflict for such a long time, the healing phase repercussions can be quite devastating. When we, if you remember, I spoke about CTs of the brain where Dr. Hammer saw this patient had edema after a massive heart attack. Well, it's the edema in the brain that will appear in all very important healing phases. So there we also need to be careful. So in a coronary, we are looking at edema in the heart rhythm center that will determine whether or not the patient is going to survive. Also, it depends on how much damage was done to the heart muscle during the conflict active phase, because there is a degeneration of cells or tissues during that period. So, and of course, with the magnitude of these epileptic or epileptoid crises, the tissues of the heart, because they degenerate, the heart can actually rupture.
But now, is something like diabetes a result of too much sugar?
No, not at all. Sugar will compromise people with diabetes, but it's not the cause. There is a very specific part of the brain that will control your blood sugar. We have one for the glycogen, and we have another one for the insulin. So, glucagon and insulin. And that means that when we have a biological shock that is actively affecting either one of those relays, this is when we will have a blood sugar disorder.
I don't know how to ask this question. So let me try my best. Do you think that there there is basically an industry around naming diseases. In other words, there aren't nearly as many illnesses and diseases as what the pharmaceutical industry tells us. It's basically all just renaming of conditions that we already have.
Well, I think, this is what Dr. Hammer was actually trying to tell us when he looked at the different organs and the kinds of diseases that could present in an organ. He narrowed it down considerably to the 3 germ layers, or let's say the three most important areas of the brain that control those germ layers. And he actually devised the scientific chart. I don't know if you're familiar with it. It's a book where he outlines the actual name of the disease, the part of the brain that will react to a biological shock, the name of the biological shock or the kind of shock that you will react to, how this materializes during the conflict active phase, and how it materializes during the healing phase. Now, when we look at the scientific chart, it's all color-coded. We have 3 embryonic germ layers that are controlled by 4 areas of the brain. Now, when we look at the pons of the brainstem, all of those organs react to biological shocks to do with survival. Okay, we're looking at vital organs. Now, the second part of the old brain, the cerebellum, reacts to protection. This is when our skin began to develop. Our skin actually protects us from the rays of the sun, right, from the radiation. And then after that, when we began to live on land, we needed to find a way to move on land. This is when our skeletal structure and our muscles and connective tissue and tendons and the lymphatic system, that's when all of that developed. And that has to do with a self-devaluation, feeling bad about yourself or being made to feel bad about yourself. Then, when we have the latest addition to the brain, what we're looking at is relationships. Okay, so all of the organs really that are covered by the outer skin are connected to the cerebrum, and the outer skin itself, which is connected to the sensory cortex, they all respond to relationships. Okay, so when we began to form groups, this is when that part of the brain began to develop. So this is the outermost germ layer, then the cerebral medulla, which affects the skeletal structure. That has to do with the new mesodermal germ layers. So we have 3 germ layers which are controlled by 4 different areas of the brain, and we react according to our evolution.
So, what is the moral of the story, Ilsedora?
The moral of the story. Well, if I'm going to give any advice to anyone, I would say live a life of harmlessness, because you never know how people will react to how you behave. I think that's going to be our future. I think that will have to be our future if we are going to evolve as the human race. We will have to take that into consideration, and I think that is really one of the biggest gifts that Dr. Hammer has given us, because once we all embrace this and live our lives accordingly and understand that the word can harm and the word can heal, that we will begin to change our behavior and begin to evolve spiritually.
And if I'm understanding correctly, there is a place for medicine, but currently everything is over-medicalized.
I think so. You know, the way Dr. Hammer has outlined it, he liked to see the body and what it's capable of. I've seen some extraordinary recoveries and reversals. And he's absolutely right in seeing things that way. The problem is that we have been conditioned to take a remedy for everything, when in fact we're stopping nature from taking its course. We're suppressing something and driving it deeper into our systems. We're not even allowing ourselves to understand its origin, which ultimately, when we do understand its origin, we can make those corrections in our lives.
But that's a very important point, because currently everything is about treating the symptoms and not looking at the cause.
That's right. But again, we've allowed that. We've facilitated that.
But then, Ilsedora, what is the purpose of pain?
It's a warning. You know, it really is a warning. Now, in my observations, at least over the last 10 years, when working with chronic conditions, the original conflicts have always been resolved. But as soon as the psyche identifies a track during which you experience that conflict, your body's going to react to that track by giving you some kind of a symptom. So it's a matter of deciphering the symptom to understand exactly what just happened, what that track was related to, and how your symptoms associate with that first biological shock. So it's a process. You know, we have to remain more conscious. We're not living consciously in any way.
But I'm thinking, for example, childbirth. Now, that isn't a negative thing. It's literally bringing life into the world, yet there is an association attached to that, which is pain.
Well, the pain really has to do with the muscles that are contracting in order to facilitate the birth. And of course, this is an epileptoid crisis, or actually an epileptic crisis, because it involves the musculature. Even the moment the ovum is fertilized and the embryo begins to form, that entire 9-month process follows the law of 2 phases. And what we're looking at is the epileptic crisis at birth, where the fetus actually becomes rigid in order to start to move out into the birth canal. Okay, so the fetus and the mother are both undergoing this epileptic crisis at that moment, and all muscle spasms involve pain, but it's temporary. It's not like you're going to be in pain the rest of your life, right?
At the other end of the spectrum, you get bitten, let's say, by a mosquito, and you get a response that's itchy. Now, that isn't a crisis, is it?
No, that's a toxin, because they inject some kind of a poison into your skin that makes you itchy. Right?
Okay, so it's as simple as that.
It's only when it's associated with a DHS, a mosquito bite.
Well, let's say malaria.
Under certain circumstances. Well, malaria is a parasite. That has nothing to do with it. So malaria is not a toxin. It's not a disease in itself. It's a parasite.
Which, of course, is in itself a problem.
Well, over time, people do build an immunity to it. People that live in these regions eventually do build an immunity to it. It's newbies like us that would be affected if we went into your environment and we were bitten by a mosquito carrying this parasite.
How can I follow your work and find out more?
Well, I'm teaching the GNM now at at a very high level through the GNM Institute. So anyone that is interested in courses, we have courses from the beginners, GNM Simplified. It's not taught by myself, it's taught by my protege, and I've been interactive in the development of the course, so everything is 100%. Then I have the intermediate courses, which are the GNM for healthcare professionals. For anyone that is in the healthcare profession that wants to go in this direction or wants to know more about it, they're welcome to enter into these courses. And then I have the certification levels for people that wish to practice this at a very high level. So we have the Institute, but for general information, you could just Google Ilsedora's blog, and you'll see all of my blogs and my rants on the GNM. And then I have the original website, which was actually put up on request of Dr. Hammer in 2000. It's called newmedicine.ca. Now, it was originally called the New Medicine until about 2005, when he had to make a change of the name. He couldn't register New Medicine, so he added German in front of it, or Germanic in front of it.
Well, I mean, at this stage of the game, shouldn't it be called German somewhat new medicine? It's a few decades old now.
Well, yes, it's been more than 40 years since he discovered the iron rule of cancer.
On that note, Ilsedora Laker, thank you for joining me in the trenches.
My pleasure.